Hello, everyone, and welcome back for Season 2 of the Wellness on Purpose podcast. Here at the Wellness on Purpose podcast, we appreciate that there is no linear path along one's wellness journey and understand how easy it can be to get caught up in the latest health trends found on social media. Our intention is to provide you with impactful, educational, and realistic information to help you progress on your journey to live wellness on purpose now and for future generations. Hey guys, welcome back. It's Marissa here, and to wrap up Season 2 of the Wellness on Purpose podcast, we're going to be featuring the different practitioners that are available through the Kawartha Care Clinic. Kawartha Care Clinic is located in the heart of Lindsay and is owned by Dr. Manju Asdhir. To start off this series, we're going to be speaking with Dr. Manju, who is a chiropractor and a medical acupuncturist. Dr. Manju works to develop individualized treatment plans for each patient for their specific conditions. In this episode, we talk about the different modalities that she uses to combine in a treatment, including adjustments, acupuncture, soft tissue therapy, and the importance of doing your homework exercises. If you're wondering whether or not a chiropractor is suitable for your wellness journey, sit back and listen to this episode. Okay, good morning, guys. Welcome back. Today we have Dr. Manju on here, and she is from Kawartha Care. So welcome. Thank you so much for being on the podcast today.
Thank you for having me.
So why don't we tell our listeners first what Kawartha Care is?
Okay, so basically I started off just myself. I'm a chiropractor and I'm licensed as a medical acupuncture provider. And so we started off Kawartha Care just as myself. And so I was practicing in Lindsay. I had a great opportunity to work with an orthopedic surgeon. And obviously, I took that on full reins, moving in from Toronto, just to Kawartha Lakes. And so we started off there. And then from there, we grew to now a 13-person multidisciplinary clinic. So right now we have chiropractic, we have massage therapy, physiotherapy, foot care, and basically the works, you can say. When I first started, we were probably, I think, the first or second woman-led multidisciplinary team. So that was a really cool thing to see coming in from Toronto, especially because, it's very saturated there. It's a very different environment. And I guess it's a small town charm. It just made it so easy and fun to grow the clinic.
So the clinic is located in Lindsay on Kent Street. And have you guys always been there?
No, so we actually moved to our current location, which is right beside Ross Memorial Hospital, about 5.5 years ago. So initially we were working in the Lindsay Medical Building with Dr. Nerona, and we were growing pretty fast. And I sort of knew 16 months in, okay, well, what direction are we heading? Is it just going to be a solo practice, or are we actually going to expand this thing? And we obviously picked option 2. And so that led us to this current location.
Amazing. That's great.
Yeah.
So I got to go and visit Kawartha Care a couple weeks ago, and it's a beautiful old building. You walk in, it's a homey, warm feeling right away. Everyone is smiling and happy, and it's a very nice clinic.
Thank you so much. It's definitely something that I strive for. I think that was always the mission. It was sort of like, you're going to spend 80% of your time at work. So, you want it to be a really welcoming environment for patients. But the only way you can do that for patients is if your staff is really happy and your team is really happy. So I'm glad that you had that experience.
Yeah, fantastic. So today we're talking to Dr. Manju, but in the later episodes that's going to finish off this season of the podcast, we're also going to be interviewing other practitioners in Kawartha Care. So each week from now until the end of the season, we're going to be highlighting a different practitioner. So if you're listening to this episode today, make sure you guys keep tuning in every Tuesday to hear about the other practitioners from Kawartha Care. But today, let's talk about yourself and your wellness journey and what you do as a wellness practitioner.
So I guess we'll start way back when. My parents came from India, so we're an immigrant family to begin with. And in the immigrant family, it's very much, I guess, norm to say you want your kids to be like a doctor, engineer, or a lawyer. It's very commonplace. And so obviously that's deep rooted in many families. And so, early on that was sort of like, okay, well, these are like your career options and maybe nothing else. And so the funny thing about all that though is at that time when my parents did come here, none of them were in those professions. They were all in sort of IT, or they were entrepreneurs, or, doing some sort of other business related positions. So it was interesting because my exposure was mainly in those fields, just with the day in, day out when you talk to your parents and your family members. As I sort of went on the journey and got older, and I was able to make more of those decisions, getting into high school and further education, I was inclined to expose myself to different fields because I felt like I had a good grasp on what I already knew, which was like the IT, the business, the entrepreneurship. So luckily enough, I was able to sort of venture into like dental offices and kind of co-op there, and summer jobs like research assistants, or I worked in, for example, like a lab, right? I also worked in like vet clinics, and I mean, like now there's like just so many. So vet clinics, optometry, you name it. I was sort of there, even if it was for a short period of time, because I knew the exposure was really, really important in order for me to make those decisions. Despite all that, I did gravitate towards sort of the more hands-on jobs and career positions. I wasn't just one person that could sit at a desk for many hours and sort of just be on a screen and do that kind of thing. And so that kind of led me again to more focus into the healthcare side of things. I did go to those offices, like the dental offices, medical offices, but the one thing that I noticed between all of that and then going to a chiropractor's office was that all the patients that went to a chiropractor, they actually went in pretty happy and came out happier. And that was a kind of like, when you reflect back, it's such a huge turning point building those relationships. And I never really saw that in a lot of the other careers that I was exposed to. And I thought it was amazing. So I remember going into one of the offices when I was, I think it was an undergrad at this point, and it was sort of like, I remember the chiropractor like laughing their head off, just having a great time with their patient, and obviously working on them as well. And just like the rapport was just so fantastic. So in addition to that, like a lot of people would say to me like, well, you want to be a chiropractor? Like you're too small for that. Or, it's more of a male led field. And I don't like those kind of comments. I like the challenge. So sort of the amalgamation of all that led me to this. And, lucky enough at this point, I feel the exact same way with my patients too. Like we always have a good time. We know about, our family, and we're pretty lucky to have that.
That's amazing. So how long have you been a chiropractor for?
So I've been a chiropractor now for 9 years.
Wow.
Yeah, now that you put it that way, it's been a long time.
In the many years of practice, would you say that there's been something that's reoccurring that you see fairly often in a lot of your patients?
So everyone thinks a chiropractor only works on low back pain. That's often like the myth, or sort of the idea behind chiropractic. For a lot of people who aren't exposed to it, what we usually see, or what I see in practice right now, is a lot of kids, like a lot of parents who are more tuned into more, they don't want to medicate their kids necessarily for aches and pains. They want to use a different form of treatment that they're newly exposed to, or maybe their friend or neighbor has been exposed to and have had great success. So I see a lot of kids. We obviously see a lot of seniors at Lindsay as well. And in terms of areas of the body that we kind of focus on it quite a bit, I would say we see a lot of shoulders, and we see a lot of sort of hip area, hip pain, pelvic sort of issues. It kind of goes with the territory for most of us.
Yeah. So with kids, would that be like growing pains and aches, or why? I actually didn't realize that so many children maybe go and get chiropractic adjustments, but would you say that it's more growing that allows them to see the relief from chiropractic, or something else going on?
So I'll give you an example. My daughter is 2.5, and I've been taking to her chiropractor since she was 3 weeks old. And obviously I'm biased as well. I know all the good stuff that comes out of it. And so, you know, for example, when a child is born, not only does it affect the mom because the mom's pushing that child or having a C-section, and those areas are going to be compromised. But if you think about it, the baby's also coming out of this tiny little vaginal canal, and often they're not really coming out that easy, where it's sort of like in a movie where they just slip out. They're sort of in different positions. Their head's not necessarily in the best placement, or their shoulders or whatnot. So right away, there can be some compromise to the nervous system. And so you can start as young as that. If you go get into the sort of the older age groups, sports injuries are a huge thing right now for kids. Lack of sports right now due to COVID. So just sort of sitting around the couch, maybe watching a little too much on the iPad, a lot of neck, a lot of thumb injuries. Texting is a huge thing right now too. So it's sort of day-to-day ailments that can affect the body, and especially for kids that are growing. I find we're seeing more things that we maybe didn't see 10 years ago, right? There's a term called text neck, which we see a lot of now too.
Yeah, for sure. So I know that we'll have a lot of parents that are listening into this episode. So could you maybe share what some precursors could be for parents to know whether or not seeing a chiropractor would be a great option for their child?
For sure. So a good precursor, or many precursors, I should say, is, if your child is complaining about any sort of muscular pain. So for example, they'll say, like, my shoulder really hurts, it's been hurting for a very long time. I wouldn't necessarily say if it was a 24-hour complaint, but if it's something that's ongoing. My daughter, for example, is growing as well, and she has a lot of leg pain right now. So, we are getting her adjusted in the knees. That's a big thing. Headaches are a growing issue as well. And often for kids, it's very easy to say, oh, we'll take them to the doctor, we'll get some Tylenol, that kind of thing. It should subside. But we see a lot of kids who've had migraines since they were like 10 years old. And often it's ongoing. Like they'll have them for 5 years. They'll start affecting their schooling. There's sort of like a slew of different things, but I would say any sort of aches or pains that a child is complaining about for, at least maybe like 2 or 3 times that they've mentioned it. But if it's more organ related, sort of like heart or, lung and all that, obviously that's when we would refer out to your family doctor. The thing is, there's no harm to come see us, because if it's something that's not in our scope of practice, we always just refer out to who's appropriate.
Yes, for sure. So obviously you see more than just children. So say adults before seniors, like adults, middle age, what would be some precursors that they would look out for as to whether or not seeing a chiropractor would be a great option for them to progress on their journey as well?
Yeah. So it's a really good question. A lot of our patients will ask them, is this affecting your quality of life? It's very important because, they might come in and say, oh, my leg's been hurting and it's been hurting for a while when I do yoga. Okay, so let's get further into that. You've had this pain for a long time, but why are you coming in now? Well, it's starting to affect my quality of life. And we'll say, okay, well, why do you love doing yoga? It helps with my anxiety. I have a lot of anxiety because I live in a household with my parents who are elderly and my young kids, and it helps me cope. So when we really get down to the basics, that's the neat part of the job. And so a precursor, again, would just be, does it affect your quality of life? Or is it stopping you from doing things that you love, that's helping your mental health, your physical health, so on and so forth? And again, if it's something that's not in our scope, we will refer out to who's appropriate, whether that's your doctor and whoever else that we can to refer to.
And then our group of seniors who may also be listening to this, they would maybe look at a chiropractor. Would that be more, would you say, natural aging and wear and tear on the body that they would be looking at chiropractor? Or what would you say for most of the seniors?
A lot of the seniors that we do see are referrals either through hip replacements, knee replacements, shoulders. That's just the nature of what we see. But a lot of them are golfers, they're swimmers, they love going to the gym, they just are so active, dancers, so on and so forth. Or, they're drivers from community care and they love sort of doing that part of their job, and it starts to affect them. So the wear and tear is natural, but the myth thing is you don't have to live with that.
Yes.
And so we really try to sort of promote a healthier lifestyle through adjustments, maybe mobilizations, different techniques that we do. And then, of course, the rehab that follows. So most of our seniors are often surprised, like, oh, I didn't realize that I didn't have to live with this pain. Like, I thought it was just an aging thing. Often my parents say that too, and they're kind of surprised with that. But with seniors, it's sort of breaking that myth and just saying to them, like, you know what, you don't have to live with that. You can actually come in and feel better and be active again.
Yeah. So that's one big myth. And I've spoken to other chiropractors before and they have said that too, is it's not something that you need to live with. You can adjust your lifestyle and you can come in and see a chiropractor to get adjustments to help relieve some of that pain. But would you say that there's any other myths as a chiropractor or as an acupuncturist as well?
So I would say the biggest one that people come with is they're scared of adjustments. They're often really nervous because they'll watch videos on like TikTok or like YouTube or something, and it'll be really harsh adjustments that it's probably not even done by a chiropractor. And they're probably just edited heavily. And so you'll hear like a big crack in the middle of the video or whatnot, and it looks very harsh. So people will come in and we'll sort of debunk those myths as well and say like, what do you think about an adjustment that we think that would be helpful? And they'd say, oh, well, I watched this video on YouTube and I don't think it's for me. And so we sort of have to go and explain it and that it's very gentle. And if they're not still comfortable, there are other ways to go about it. So acupuncture is a big one as well. A big myth with acupuncture is that it hurts. It hurts, it hurts, it hurts. It's like the flu shot. Everybody thinks that. And so the needles are so thin, they're the size of a human hair, and they go in like half an inch, right? Depending on the body part. And so you don't even feel them. I'm scared of needles too, and I can do it on myself. So that should say a lot.
Is adjustments and acupuncture the only option, or are there other types of modalities that you can use to support one of your patients as well?
Yeah, so we do a whole bunch of stuff, and about 2 to 3 times a year, we do professional development within the clinic for all of our staff. So we bring like an expert in-house and sort of learn different tools that we can add to our toolbox. So adjustments and acupuncture are great if the patient is not comfortable, or maybe that's not the appropriate measure for them. Then we'll do things like mobilizations, we'll do stretching, we'll do rehab at home with them, which we can do virtually now too. We can do things like athletic taping, for example. So there's a lot of different things that we are trained for that either are more suitable to the patient and will give better results to the patient, or in some cases they're just more comfortable with those modalities as well.
So even if you did adjustments in acupuncture in person, do you usually give your patients homework as well too to help with them?
Yes, definitely. My thing is, I tell my patients, I want to see you here, but really I want to see you at the grocery store feeling awesome. And the only way to do that is so that you do your homework. And it's funny, we have a lot of teacher patients, we have a lot of seniors, and they'll say, oh my gosh, I have to go back to doing homework now? We have a good laugh about it, but it is so important. Like if you are, for example, now working from home, sitting at a desk 8 hours a day, even if I adjust you once a week or once every couple weeks, what are you doing the other 6 days of the week to help yourself, right? And so we really, really, really believe in the rehab portion of it. And we have a new program that, we send out to patients where it's little videos that helps them out. And we can do virtual rehab where we can talk them through it if they're not comfortable or they're not sure if they're doing it correctly. But it is huge. It's probably I would say the most important part of care.
Yes, absolutely. And to all of our listeners, I know if you've been listening to other episodes, you know that I've talked many times about consistency. And, it's not about
Yes.
motivation. It's not about being dedicated to something. It's being consistent with a routine every single day. That's when you're going to see the results. It's not going to come after one time, two times, 10 times. And every practitioner said the same thing is it's something that you have to prioritize every single day in your routine, whether it's 5 minutes of stretching or an hour of movement or whatever it is, it has to be consistent for sure.
That's right. That's 100% on point. Yeah.
So for our listeners right now, from a chiropractic perspective, what is something like maybe a stretch or a movement that our listeners can do that's suitable for everybody that can just support the body overall that they can do every day?
One thing that we've been doing with a lot of our patients since COVID sort of, closed everything down and everyone's sitting a lot more, either watching Netflix or on their desk working or whatnot, is the 20-20-20 rule, which is once you implement that rule, you'll absolutely love everything about it because it makes such a difference right away. So the 20-20-20 rule is getting away from where you're sitting after 20 minutes of work. So let's say you're sitting at a desk for 20 minutes, get up after 20 minutes, set it on your phone, set it on your clock, put it as a reminder. So after 20 minutes, you get up, you look 20 feet away for 20 seconds.
Okay, fantastic. That's
Does that
really
make sense?
great. Yeah. So you're sitting, watching, or you're on your computer for 20 minutes.
Yeah.
You're going to stop at the 20-minute mark. You're going
Yes.
to either get up or look at something different for 20 seconds.
And you have to make sure that's 20 feet away.
Okay, fantastic. So that could be going to get a drink of the water, going to the washer, maybe stepping outside for 20 seconds. I love that rule, 20-20-20. And that's very easy to implement.
It's super easy. You don't need to buy any special equipment. You don't need to have a fancy ergonomic setup. It's just helps your body reposition, your muscles sort of reset, reduces digital strain on the eyes, which is important. And honestly, having a glass of water, because we all know we probably don't drink enough water as it is. And so it sort of helps in all three capacities, and it's super easy to do.
Yes, I love that. That's fantastic. So that's definitely probably something that you implement into your everyday routine. But would you say that there's something else in your wellness journey that's been tried and true over the years that you try to get into your routine every single day?
So one thing I would say is just going back to that idea of consistency and routine is super important. So when I was in practice for about 5 years. Everything was unroutine at that point, right? Because you're sort of figuring things out, and half the time your breakfast is really your lunch, and so on and so forth. So you can't really be there 100% for your patients if you're not there 100% for yourself. And so after those 5 years, I had my daughter, and I thought to myself, there's no way I can do this if I don't have a routine in place. And so that's when, exercise is a routine, your breakfast at a specific hour, making sure you are eating lunch, so on and so forth. But the biggest part of all that was sleep. That was the big, big, big thing for me. And we all know that, most of the people that you're around don't get enough hours of sleep. We've heard that many, many times before. There's lots of really good studies that show people who, if you sort of let them sleep for a span of time, whether it's 2 or 3 weeks, as much as they need to sleep, so there's no alarm clock ringing. They show that in basketball players, they did that study and they sort of let them sleep for 2 weeks as much as they needed. And they actually ended up being better at free throws, not free shooting. And then also their sprint times were a lot faster in practice as well.
Wow, that's amazing. So basically that's kind of resetting the cognitive, the brain function, the waves, and just allowing the body to
Yes.
actually rest.
Exactly. And, they always say like 8 hours of sleep, but that's not really realistic, nor is that necessary. Usually it's within that 6 to 7 hour mark, but having the routine. So, okay, well, I am going to turn off my phone at this time and spend some half an hour just vegging out a little bit. And then this is my sleep time. It doesn't have to be exact, but maybe a ballpark. So I go to bed, let's say 10 o'clock, I wake up at whatever hour, and that's your routine. So the rest of your day then follows and can sit really well also.
Yes, that's awesome. And another really big piece to that in the routine is when the body is naturally in a state of routine and things just come naturally, we don't have to use as much energy or we don't have to think as much about it. The body the body's stress levels also decrease because they're not in a state of what do I have to do next? Like where do I have to go? What do I have to do? I mean, yes, people's schedules will elevate that stress level naturally, but if we can try to alleviate as much stress by having more of a routine, we can have that balance between that highly stressful schedule and that off time as well.
Yeah, I totally agree. That's a good point.
So, with your wellness routine, so you mentioned sleep is really important. The 2020 rule is really important. But would you say that there is a product, like a supplement or something else that maybe you use every single day that you think is safe for everybody to take to support their wellness journey?
So, going a hand in hand with sleep, because that's such a huge thing. When I had a big lack of sleep, I was deferring to coffee quite a bit, caffeine. And so since then, and I love sort of all health food stores and I kind of gravitate towards that. But what we've done is in our house is we've kind of cut the caffeine a little bit because we noticed that when we're not drinking it daily, the headaches come up, as do for a lot of people. So we actually gravitate towards sort of like the caffeine free teas. So like a lot of them are at Joann's as well. So I've done the mother's milk one before when I was breastfeeding, just chamomile, mint, sort of like just a very safe for the most part. It doesn't interfere with any medications that you're taking, again, for the most part. And again, caffeine free. So you're having that warmth that you need sometimes, that comfort that you need, but not necessarily the consequences of taking in too much caffeine or then the lack of caffeine as well.
Absolutely. And I think coffee is a very hard thing for people to give up, not only for like the caffeine addiction, but I think also like the whole idea mentality around that morning cup of coffee. It's just like this like idea that everybody wants to have their morning cup of coffee. But like the long-term and overuse effects of caffeine can be very detrimental to many people's sleep schedules, their hormones, their insulin. There's many different aspects, but it's hard for people to take the transition away from coffee. So as a nutritionist and a product educator, a great way you could start to do that is just start with decaf coffee and then just make your way to having more herbal teas like peppermint and like hibiscus and things like that are nice. But the other really great aspect is by drinking more herbal teas is you also increase your water intake without depleting it with caffeine. Caffeine is actually more of a diuretic and people don't know that is it actually is dehydrating for the body, whereas herbal teas is actually very hydrating for the body.
Yeah, definitely. I actually, so I went to get blood work done a couple of years ago, and this was sort of a turning point for me. So what had happened was they couldn't find my vein. And they're sort of like, okay, so, you drink coffee. And I said, yeah, I do drink coffee. And think I was drinking so much so that I was so dehydrated that this idea of like, oh, you're drinking, they kind of mentioned it, like you're drinking too much coffee. Like you think it's good and it's okay because it's a liquid, but really your body is dehydrated. And so you start thinking like, oh, well, this is not just the whole idea or concept of like, oh, well, I need it for the morning cup. It's like, this is really affecting everything internally. And it is scary.
Sorry. Now, as a chiropractor, would you see or would you be able to tell when your patients are more dehydrated based on different adjustments, if they're like more tighter or maybe you're not able to move certain joints and things like that because of dehydration?
Yeah, definitely. So when we do our intake form for our patients, we actually ask them how many hours of sleep they get, how much water they drink, if they smoke. And so a lot of those have repercussions on the total body as well. It's not always with adjustments that you notice it, but you just notice it, even if you're doing sort of orthopedic tests on them to making sure, like, oh, is it the joint? Is it the disc? Is it a muscle that's an issue? You sort of notice it right away because often those complain of things like spasming in the legs or shakes, or they'll say like, oh, well, that's like really, really tight. And you're like, well, that doesn't seem very normal, or that doesn't really coincide with what we're thinking in terms of a diagnosis. But it's the precursor part when we spend that time going through their history and come up with those symptoms. We sort of say, okay, well, you're not on any medication that would cause that. What's your water intake? And that's when it sort of creeps in there. Or let's say they say, well, I have headaches, I've had them for a year. And we'll ask them, like, how much caffeine do you take? And like often we hear a couple pots of coffee a day. And that's sort of like, okay, well, let's cut that slowly, because despite what we do here, if we don't do our homework, it's still not going to be helpful.
Absolutely. So, okay, a little rundown for our listeners of what it would be like being a patient to a chiropractor. So they have that intake, you kind of go through their history. Do they just jump on the adjustment bed right away, or what does it look like?
So what would happen initially is when you're booked in to see a chiropractor, front desk or admin staff will ask you a couple of questions as to the area of concern. And the reason that we ask that is because since we have a slew of different practitioners at the clinic, often, you may be thinking that you need to see a chiropractor, but really you need to see a different type of practitioner. So we try to help you along the path. The second thing is, if you are booked in with a chiropractor like myself or Dr. Jill, what would happen is the first thing we ask you to do is fill out your intake form. So that's something that's sent to you prior to your visit, and we will usually review that 24 to 48 hours in advance. So we know what we're dealing with and what you've come in for. We're well prepared. When you come in, we go through a thorough history and assessment. So we sit down, we kind of have a nice conversation about what you're in for, what are other areas that are of concern to you. We talk a lot about, the onset, the duration, things that aggravate the area, things that relieve the area. And so there is a whole bunch of questions that we will go through and have that conversation. But we'll also sort of dig in further and say, like, why is this important to you? Like, why are you here now if you've had this for 20 years? Maybe it's because it helps with your anxiety. Maybe because you want to play with your grandkids and, you're excited to do that for the next 20, 30 years. You want to see them grow up and you want to be healthy. So we do the assessment, we do the history, and then what we'll do is some testing. So we're all trained in orthopedic testing, which is basically what an orthopedic surgeon does as well, more or less. And so we go through these tests based on your history to determine a diagnosis. We want to know and confirm we know what we're dealing with before we even put our hands on you.
Okay.
And some people need x-rays, so we'll refer them out. But most of the time, the history plus the physical part of the exam will tell us quite a bit. And at that point, we sit down and we say, okay, this is what we're dealing with. And this is sort of the plan, your treatment plan, or what we're thinking and how long we think it's going to take you to get better. And this is what we'll be doing. And we sort of want to make sure you're comfortable with that, you're knowledgeable about all that. Like we might say acupuncture and the patient says, oh, well, I've never done that before. So let's talk about that to make you comfortable. If it's something that we cannot deal with or it's not in our scope of practice, let's say maybe it's more, we think, organ related, then we'll refer you back to your GP and we'll say, that's the more appropriate measure for you.
Okay. And like the diagnostic exam, is it like a scan of the body, or is it more like, looking at like where their shoulders sit, if they're leaning forward? Is it that type of like exam that you're doing?
It depends on the area of concern. So we always look at posture. That's a big thing. We look at range of motion of the joint above and below the area of concern. So, for example, if it was your shoulder, we would look at the neck, but we'd also look at the elbow as well and how the range of motion is in those joints as well as the shoulder. After we do that, we would look at, the skin changes. Is there any deformities in terms of where the position of the shoulder is? And then we also have specific tests that indicate if it's a tendinitis or if it's a tear or, if it's sort of more, an osteoarthritis, so on and so forth. But we also have specific tests that sort of let us determine what the diagnosis is, depending on the area of concern.
Fantastic. Okay, so we already kind of touched on this throughout the entire episode, but I want to do a recap with you. For our listeners who are listening right now, some things that they can implement into the routine starting today would for sure be the 20-20 rule. I think that's been such a great recommendation. We also want to look at making sure we're drinking enough water, whether that is through herbal teas or just plain water. And then lastly, making sure we're getting a good amount of sleep, right?
I agree. Yeah. So the 20-20-20 rule, super easy. Again, get away from your screen, look 20 feet away for 20 seconds. Super easy. Everyone can do it right away. And if you want to even sort of make that a little bit more better use of your time, in those 20 seconds, grab some water, hydrate yourself, some herbal tea. Both are good options. So you're kind of doing two rules at once. And the last one is sleep. So, we talk about it a lot, but start making a routine for your sleep schedule. So, whether that starts with, I can only get in 7 hours, okay, no problem, or even 6, but these are your sleep times, and this is when you're going to get up. And the rest of your day will naturally fall into a routine. And honestly, you'll just feel a lot better, a lot less stressed out as well.
Awesome. I love that. So for our listeners, if you are going to be implementing those into routine, make sure that you tag the Wellness on Purpose podcast as well as the Kawartha Care on social media to show us that you are implementing those. If you want to connect with Kawartha Care, I will link the information in the bio for you to do so. But I really want to thank you so much, Dr. Manju, for joining us today and to bringing your entire team onto the podcast over the next few weeks.
Thank you so much. I really appreciate it. I'm super excited, and I hope it was helpful.
Yeah, for sure. Thank you guys so much for tuning in. Please be sure to like, subscribe, comment, and share on social media that you're listening to the Wellness on Purpose podcast.